Good afternoon. Just going to give you a bit of an update over the weekend. Things seem to be stable at the Ontario front with 1,023 cases increase between yesterday and today, and really stabilized at the 1,000-1,200 level. Again, Toronto, Peel, York leading the way, although York was lower in numbers. Ottawa Public Health at 72. In terms of our numbers, I just want to share my screen right now. We added over the weekend. Where are we? Here we are. We added, I think, 28 over the weekend, over 2 days. So in terms of the change, it was 8 from Akwesasne, 7 from Cornwall, 5 from SDNG, and 8 from Prescott-Russell. Again, lower numbers relatively, but again, we're seeing that those are there. The good news is that our outbreaks have gone down tremendously. We're now just 4 active outbreaks, and I'll talk about those later. We have 6 currently hospitalized, 4 are in Cornwall and 2 are in the Ottawa Hospital, and we continue to vaccinate. This is the number so far. Again, we keep adding to that. We had clinics over the weekend. I will talk about vaccines shortly. Looking at our rolling average, you can see here that we again are kind of floating around the orange level here, right? We're in here. As you know, red is 40 and above, so we're kind of hovering there. Cornwall's a bit high here, but again, that's just a couple of days, just a day or two, so we can see what the trends are. But again, we're clearly kind of in the orange area on average, but again, pulled up by some of the Cornwall numbers. Again, those are just things that we could see more. We get a better trend. We remained in orange as per the ministry's request, and we have not changed at this point, but we will be reevaluated every week. And again, we need to be cautious in that regard. Just in terms of some of the other things that are going on with us right now, obviously we do continue to have those variants of concern that we're looking at. We have not had any confirmation from the laboratory yet, but I can tell you that looking at the situation at St. Albert, I know if people have the question. We have got back. We tested all the individuals who were low risk and high risk as well, and essentially we've got over 93% of the results back, and they're all negative. So we're pending just a few at this point in time, and we're again working there. I understand they did open over the weekend, but again, we have no concerns other to the public or to the quality of the food contamination or anything like that. No concerns whatsoever. Again, we're working there. So far, we've limited to those 3 cases there, and hopefully it'll be status quo moving forward in that regard. Like I said, the ministry gives us variants of concern. They screen them, and then they give us positive results. So we're just awaiting for those moving forward in that regard. Again, I'm happy to say that it's been contained, and like I said, the reason we worry about the variants of concern is the fact that they do spread easily. So in this case, it doesn't seem like we've had any other spread, but again, we'll keep an eye on that as we move forward. In terms of our outbreaks, again, there's only 4 that remain. Woodland Villa has now 50 positive residents with 4 active, and 1 is in hospital actually. 8 from the 18 positive staff, we still have 2 that are active, and we've had no more deaths from that institution. The Palace it remains in outbreak. However, no residents. Again, Riverview Manor. Actually, we closed 3 over the weekend, so we only have 2 more left, and actually 4 more left. 2 that I've mentioned. 1 is in Akwesasne, and the other one is Glenstore-Dunlage, and then both those last ones do not have any residents involved at all. So that is good news, and the numbers are going down, and we are seeing the numbers of outbreaks down provincially. In terms of the schools, again, we've added 2 more individual cases and 2 more schools in our area. And so we still have one outbreak, but that's it. So out of 9 schools, we've got 10 cases in 9 schools. Again, low numbers, but again, we're just keeping track of that as well. So now let's talk about vaccines. And over the weekend, we were busy going to the remaining retirement homes and long-term care facilities as well. We held some fixed site clinics at our in several areas in Rockland and Classman and in Cornwall. We're now offering clinics for healthcare providers and essential staff and essential visitors at long-term care and retirement homes at these fixed clinics. We're also expanding it for healthcare providers. Hospitals are being vaccinated. Community healthcare providers are going to start to be vaccinated as well. Moving forward, we're now working with the LIN to identify home care patients and preparing ourselves for the 80+ population. Again, all of this, the dates of which when we start that will depend on the arrival of vaccines. As you know, we have only been receiving really, for the most part, Pfizer vaccine. We received our Pfizer allocation this week. It was 3 trays. And we're set to receive another allocation of 3 trays next week and the following week. However, we have also been told that we should be expecting a substantial shipment of Moderna over the next. There'll be some decisions made in terms of numbers of allocations to us by the end of the week. So hopefully we'll be able to start vaccinating even more and speed up the multiple groups moving forward. For that. Now, the big news obviously is AstraZeneca vaccine has been approved. I was just reading the newly released NACI, the National Advisory Committee of Immunization, for AstraZeneca vaccine. And from what I've been seeing, the efficacy is up to about the 80% range. It's a 2-dose vaccination. It's a vaccine that's made a bit differently. It's a protein spike that's on a vector, on a dead virus type of thing. And again, it stimulates the immune response, but unlike the Moderna and Pfizer vaccine, this one does not have to be frozen and can be transported in regular, vaccine temperatures, 2 to 8 degrees, which is the routine that we have. What I've also seen in this is that, and then we were waiting for the NACI statement today. Like I said, I just got it literally, at 3:44 today, and I haven't had real time to really quickly look at it all. But I do know that again, what they were saying is that it's a 2-dose vaccination, and that you need to wait up, at least 28 days, but 4 weeks. But some go up to longer period of time, like up to 12 weeks. And it seems, just from the preliminary studies that I was seeing here, that the longer you wait between the dosages, the higher the efficacy is overall. One of the things that I noticed, though, is that like other countries in Europe, the association NACI has recommended not to use this in individuals 65 years of age and older. Again, I think that what the reason is there were not enough. They had thousands and thousands of in the other age groups, but they didn't have enough. I think they only had a couple of hundred in the elderly group. So we're waiting. Obviously, what happens is NACI makes the recommendations, and then each province, tailors it to their own needs. So we're waiting for provincial direction as to what the age group will be. But it's not surprising to me that this was a decision that was for less than 65. But there's a lot of groups out there that are less than 65 years of age. So we can have now various vaccines for various groups. And this is not unlike, the flu. We have multiple, we have high dose flu, we have adjuvant flu, we have different types of flu vaccines for different populations based on their ability to respond to those specific vaccines. So moving forward, we're excited about getting more more vaccine on our hands. And also, as you know, In the United States, another vaccine was actually approved as well, which to me is a game changer because it's a one-dose vaccine. It's the Johnson & Johnson vaccine, which in Canada should likely be approved this month. That's what I heard from Health Canada. So things are looking good again. They're starting to strike, increase, and we should be getting, again, as predicted, as we enter into the March 1st today, as we enter over the next couple of weeks of March, we will be seeing, I believe, a very good increase in our numbers, and we'll be rolling it out more. Our teams are very busy setting up multiple sites, looking at fixed sites, looking at arenas, looking at everything across our area. To be able to start doing those, working with partners. We have vaccinators in line. We've got everything organized in terms of being able to roll it out. And I do believe, like I've said it before, that we will be rolling out to multiple different groups, essential workers, persons less than a certain age group, and from 80s to 70 to 60 and those type of things. At the same time, people with underlying chronic medical conditions. So, and again, we'll get at some point, a lot of vaccine availability. So we'll be able to roll it out at multiple venues, including pharmacies and primary care doctors. Bonjour tout le monde, on va commencer avec les chiffres antérieurs. En effet, on a eu une augmentation des cas de 1023 depuis les jours précédents. En effet, on reste stable entre 1000 et 1200 cas de quotidienne. Toujours Toronto qui mène. Autour de Toronto, Ottawa avait 72. Au niveau du bureau de santé de l'Est de l'Ontario, on a ajouté 28 cas cette fin de semaine. Ici la variation, on voit que 8 étaient d'Akwesasne, 7 étaient de Cornwall, 5 de SDNG et 8 de Prescott-Russell. Donc, total de 28, mais depuis vendredi. Donc, au niveau de nos moyennes mobiles, on voit qu'on est toujours dans l'orange. On approche rouge ici avec Cornwall, mais à la moyenne, on est avec l'orange. Et ceci, c'est à cause des dernières cas qu'on a ajoutés à Cornwall. Mais si on voit ça à la moyenne, on est toujours à l'orange. Ça se peut qu'à chaque semaine, on fait une réévaluation, mais cette fois-ci, on a resté à l'orange. Au niveau des autres chiffres, on voit ici qu'on a 6 hospitalisés, donc 4 sont à Cornwall, aucune aux soins intensifs, 2 sont à Ottawa. On n'a pas de changement au niveau de décès. Vous voyez ici, on a juste 4 flambées qui restent, en effet. C'est des bonnes nouvelles. Il y a à peu près quelques semaines qu'on avait, je pense, 28, mais on avait beaucoup plus. Et on continue à vacciner les gens avec les doses qu'on reçoit du ministère. Je vais vous en parler tantôt. Pour ça. Donc, au niveau des autres nouveautés que nous avons dans notre région, je vais vous donner une mise à jour au niveau de situation à Saint-Albert. Nous avons testé tous les employés et je peux vous dire que plus que 93% des résultats sont venus et tous sont négatifs. Donc, on continue avec l'approche de flambée. Et on attend les autres résultats. Donc, dans ce sens-là, on n'a pas d'autres cas depuis les 3 que nous avons décelés la semaine passée. Donc, c'est à suivre avec ces personnes. Au niveau des occlusions, au niveau des flambées, comme je l'ai dit tantôt, il reste 4 flambées actifs, donc une avec des patients, des résidents positifs, 50 à Woodland Villa. Parmi les 50, on a 4 qui sont actifs. En effet, une est à l'hôpital actuellement. On a 18 employés avec 2 toujours actifs. Donc, on continue à surveiller de façon étroite. Au niveau des autres, les 3 autres maisons qui restent en flambée, aucun résident. Au niveau de nos écoles, nous avons 10 cas dans 9 écoles. On a ajouté 2 la semaine passée, mais il n'y a aucune autre flambée ajoutée, sauf celle-là qu'on avait à Glengarry District High School. Là, Au niveau des vaccins, on va parler de vaccins. On a des bonnes nouvelles dans ce sens-là. Ce fin de semaine, nous avons, on avait plusieurs cliniques simultanées. On a bien sûr continué avec nos visites, nos cliniques mobiles aux maisons de retraite et maisons de longue durée. Et aussi, nous avons, des cliniques fixes de Castleman, Rockland et Cornwall pour des personnes qui travaillent, les travailleurs au niveau des travailleurs de la santé, paramédics, etc., premiers répondeurs, tout ça, qui ont été vaccinés dans nos cliniques. Nous avons reçu aujourd'hui 3 tablettes, à peu près 3300 doses de Pfizer. Et nous continuons avec les phases que nous avons. En effet, on a de bonnes nouvelles que dans quelques semaines, apparemment, on va savoir d'ici quelques jours une livraison importante de Moderna en Ontario et nous allons en profiter. Et ça va nous permettre de aller donner des soins à domicile, etc. Parce que Pfizer, on est limité avec la façon qu'on pourrait le transporter d'une place à l'autre. Donc, ça, c'est des bonnes nouvelles. Aussi, comme vous savez, sûrement entendu que le vaccin Astra a été approuvé vendredi passé par Santé Canada. C'est un vaccin qui est un peu différent au niveau de la façon que ça fonctionne, mais c'est plus facile à transporter, aucun besoin de congeler. C'est transporté de façon de routine 2 à 8 degrés Celsius. Comme les autres vaccins de routine que nous avons. Et ça se donne dans 2 doses. Et l'efficacité dépend, au niveau des 2 doses, dépend la période dans laquelle on va attendre. Si on dit 4 à 12 semaines entre les 2 doses, et le plus qu'on attend, semble-t-il, qu'on a une plus haut réponse au niveau d'efficacité. Donc, à peu près 86%. Et on peut voir aussi qu'avec les aînés, les personnes plus que 65 ans, on a peu de données. Donc, comme on a fait en Europe, je pense, ici, l'Association nationale de l'immunisation du Canada ont recommandé de ne pas donner AstraZeneca aux personnes âgées plus que 65 ans. Ça ne me surprend pas parce qu'on n'a pas beaucoup de données. Ça ne veut pas dire que ça ne marche pas, mais ça veut dire qu'on n'a pas assez de données pour le recommander à ce moment. Au niveau des effets secondaires, semble-t-il que sont semblables que les autres vaccins. Et aussi, faut dire que on va recevoir pas mal de vaccins d'AstraZeneca et avec cela, on pourrait commencer à vacciner les autres groupes. Donc, avec l'attente de Moderna, on va recevoir des doses de Moderna d'ici quelques semaines. Donc, avec tout ça, on va avoir pas mal de vaccins qu'on pourra vacciner plusieurs groupes dans phase 1 et phase 2 simultanés. On est prêt de le faire. On a pas mal de places identifiées au niveau des cliniques fixes, des cliniques mobiles, des cliniques des masses immunisation, etc. Même les cliniques à volant aussi. Donc, il s'agit de recevoir les vaccins. Donc, on a de bonnes nouvelles. Aussi, on s'attend aussi que le vaccin Johnson & Johnson, qui est une dose seulement, va être accepté d'ici quelques semaines, sûrement au mois de mars. Donc, on aura beaucoup de vaccins d'ici quelques semaines et nos plans vont augmenter. On va augmenter avec le débit avec lequel on va vacciner les gens. Donc, ça, c'est des bonnes nouvelles dans ce sens-là. So I'm going to go and answer a few questions, and then we'll get to the media. I've got a question here about my word about the third wave. Well, I'm actually optimistic about the fact that if we hold down and continue with our precautions, and as we vaccinate more people, I'm less concerned about it. There was a question about AstraZeneca, which I've responded to. Group homes, was group and congregate living are on phase 2? That's a question that I had about group homes, and they're going to be in phase 2, not in stage 3, because there's a question about it. They're going to be in phase 2, stage 2. And the other one is about St. Alfred Cheese. There are 11 high risk, and the rest were low risk in terms of contact tracing. And that's all for the questions, and we'll take it from the media now. Jenna, any questions, please?
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blancher, Morrisburg Leader. Please go ahead.
Go ahead, Philip.
Hi, Dr. Paul. The 4 cases that are the variants of concern at St. Albert's, have you identified which strains those are yet?
Not yet. I was just on the phone with Public Health Ontario. Not yet. It takes about 8 to 10 days to identify them. There's 3. There's 3, not 4.
Okay. Yeah. Okay. So it's 3 now, not 4. Okay. Got it. Okay. And well, sorry, the four cases total, because there was one separate.
A separate one. Yeah. It wasn't related to that. Yeah. We haven't gotten them yet. No, we're waiting for the response. And what I also found out today is that sometimes they screen positive, but you can't get, then they come out negative. It's a false positive. So that's why I hesitate to sort of say that they're all positive, but they give us an alert when the screening is positive.
Okay. And concerning Woodland Villa, I was looking at your vaccine list for retirement home and long-term care homes. The residents there received vaccines on the January 22nd and February 12th. So they're earlier in the vaccination scheme. Were people who were vaccinated, were they ones that came down with COVID-19, or were they ones that didn't, or did they already have it?
We vaccinated. Actually, when we went in there, and that's a good question. The question is, do you vaccinate somebody who's already got COVID? Mm-hmm. And do you vaccinate? So there's 2 parts. And if so, when do you vaccinate them? So the answer is yes, we would vaccinate people who have had COVID. And in fact, they do need a second, they do need it to boost up the response as they get older. So yes, so we did vaccinate them. There were, if I'm not mistaken, this is by memory, that there was 1 or 2 individuals who, when we vaccinated them, they developed COVID a bit later. And I believe that it was because they were incubating it. So, however, most of the time what we try to do when we go into the homes is try to, figure out a way, well, what can we go in when that's the least amount of people that are infectious, but we can't prevent that. So we didn't want to not go into the home. So that's why we vaccinated them. But there was also an interesting study that I saw, I think out of Israel, that they noted that a person who had COVID positive, when they gave them the first dose of the vaccine, they tended to have a higher response to the dose. It's almost as if the first infection was the first vaccine, and the second one boosted it. The first vaccine. So it was interesting. But again, that's why we vaccinate both. Yes.
Okay. No, I just want to know with the dates, the way they lined up, if anybody got caught with having received the first dose, but it wasn't fully effective yet when they contracted it.
And I think yes, actually.
Okay, great. Thank you.
No problem.
Our next question comes from Natasha Wood, Nation Valley News. Please go ahead.
I think you're muted, Natasha. There you go.
Can you hear me?
Yeah, I can hear you now.
Can you hear me? Okay, wonderful. Hi. I just wanted to ask a question. Sorry, do you think that the decrease in outbreaks in long-term care homes is a direct result of you vaccinating?
Yes, I do. And I think we see it provincially. As a matter of fact, according to the science table, we've seen it, like I said, provincially. According to the science table, as of last week, there were estimated about 450 deaths prevented. And so we're seeing a drastic decrease in that. So I think it's not only locally, but we're seeing it provincially as well. So that's good news.
Okay, wonderful. Thank you so much.
You're welcome.
Prochaine question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr Paul.
Bonjour, Denis.
Dr Paul, quand la vaccination de masse va-t-elle pouvoir commencer dans la région? Va-t-on pouvoir commencer à parler de vaccination de masse lorsque vous allez recevoir, par exemple, les livraisons en quantité substantielle du vaccin produit par Moderna, par exemple?
Oui. Oui. Mais premièrement, ça dépend les doses qu'on va recevoir, mais au niveau de clinique d'immunisation de masse, on parle des stations, des cliniques où on va avoir 10-20 tables qui vont vacciner à la fois. Mais ça se peut qu'on va le faire avec les populations ciblées, disons qu'on va commencer, peut-être on va dire, OK, on va faire des cliniques de masse pour des personnes en tel groupe ou pour des personnes en tel âge. Et on envisage que si à un moment donné c'est ouvert à tout le monde, on va avoir besoin de ce type d'approche. Pour le moment, on a d'autres cliniques aussi, Denis, c'est les cliniques fixes qu'on a comme 5, 6 tables à la fois qu'on pourrait vacciner, mais j'ai été un autre au fin de semaine à Castleman et à Rockland et j'ai constaté qu'on était un peu limité parce que on n'a pas pu mettre plus que 5 à 6 tables à la fois. Je veux dire les stations de vaccination, c'est ça que je veux dire au niveau des tables. Et donc, c'est pour ça que là, on va commencer à aller aux arénas ou des centres communautaires plus grands. Et au fur et à mesure, on va ajouter, si disons qu'on a besoin de 10 stations de vaccination de chacun, on va être capable de le mettre. Si on a juste 5, on va le faire. Donc, il y a toutes sortes de différents types de places qu'on pourrait vacciner.
Bien entendu, ça dépend du nombre de livraisons de vaccins que vous obtenez. C'est directement lié à ça, mais est-ce qu'on parle de quoi? De quelques semaines, de 2 semaines, de 3 semaines?
Apparemment, je vais recevoir du Moderna le nouvel chiffre mercredi ou jeudi cette semaine avec des chiffres. Donc, je vais savoir dans quelques jours. Mais aussi, je m'attends aussi qu'avec AstraZeneca, on va recevoir du vaccin aussi. Donc, je pense cette semaine, d'ici la fin de semaine, cette semaine, on va être capable de voir quel chiffre qu'on va recevoir, le quintet qu'on va recevoir. Et à ce moment-là, on pourrait calculer parce que là, déjà, on a vraiment les chiffres de population de chaque groupe. Donc, on va être capable de dire, OK, si on reçoit 10 000, on pourrait faire 10 000 personnes de tel groupe. Et on va le diviser à ce moment-là. Donc, c'est pour ça que c'est difficile pour nous de dire, oui, on va faire telle chose là, telle chose là. Nous avons des places déjà ciblées et prêts à aller, dépendamment du débit qu'on va recevoir et aussi, Denis, le type de vaccin qu'on va recevoir. Comme je dis tantôt, si on va recevoir beaucoup du AstraZeneca, on ne peut pas aller avec les personnes âgées. Donc, on va concentrer sur un autre type de population.
Merci beaucoup.
Pas de problème.
Thomas Stockting, TVC22, asks if the 11 high-risk contacts in Saint-Albert are self-isolating for 14 days.
Yes, they are.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Seems that those are all the questions for today, Dr. Paul.
Thank you very much. Merci tout le monde.